Hello, I'm Anna Segsworth, and today I'm doing a mock physical exam on a horse. So we have our horse right here. And the first part of any physical exam on a horse is observing them from a distance. So maybe across the pasture, maybe while having their owner lead them up. I would be looking at their gait, their mentation, and any other observable things from a distance. So some important things for mentation on a horse are looking at their head carriage. Is their head low? Is it raised? And then for mentation, I'm looking for bright and alert, or quiet and alert, or maybe dull. Dull horse would have a very low head carriage, maybe moving slowly. I'm also at a distance looking at their gait. So are they favoring any limbs? Is their gait even from a side view, from a back view, from a front view? Are all of their legs symmetrical or not? And this will be important to look into deeper later, because one of the biggest quality of life problems with horses comes from their hooves. So it's very important that those hooves are healthy. And once I've done my examination from a distance and they're a little bit closer, I might move on to their body condition score. And a body condition score on a horse that isn't a stallion, isn't pregnant, isn't a foal, what we're looking for is that the neck isn't too curved up and out, and then from the back view they should have a flat back view. And if I'm looking at the back, I would have somebody holding their halter at the front, and I would be pretty far back so that I don't startle them and get kicked in the back. On the back of our horse, it is indeed pretty flat. If there's no curved gutter at the tailbone, which would indicate excessive fat accumulating back there. And in our case, this is flat, but the neck is curved, so I'm going to give our horse a body condition score of like a 3 out of 4. After body condition score, I might move on to the head. So I would be looking down in the ears while somebody restrains, and I'd be approaching the horse from the left side to begin with. So on the left side, starting with my head examination, looking in the ears, looking for debris, looking for parasites, looking for any redness, inflammation, or possibly any injuries to the ears. Looking in both ears and noting what color the discharge is, if any. After ears, I might move on to the eyes. There are a couple different tests to do on a horse for the eyes. Aside from just looking at the conjunctiva, which would show us a mucous membrane status. Mucous membranes, indicator of perfusion. Be looking if they're pink, that's perfect. If they're red, that might mean inflammation or an injection. If they're pale or blue, that's a bad sign, could be cyanotic. Yeah, and then also gently pressing the conjunctiva to get our CRT, show how fast the capillaries are refilling there. Moving on with the eyes, there's the dazzle test, which would be just taking like maybe a pin light and shining it in the eyes to make sure that they're responsive to that. PLR, which would be how the pupils react to that light, and then menace, which is just making sure that they can respond to a visual cue, but not necessarily a light cue. So be moving my hands and kind of gently approaching the eyes to make sure they respond to that. Next, I might want to go ahead and get my temperature, pulse, and respiration. So from a distance, I can get the respiration and just time it on a watch. A normal respiration for a horse would be 10 to 14. So I'd time it, set a 15-second timer, watch them breathe, and note what I got and if it's outside of that expected 10 to 14 range. For the temperature, I'm not going to go directly behind them, again with somebody gently restraining the horse from the left side. Gently lift the tail and go ahead and take a rectal temp. Normal temp on on a horse would be up to 101, and between 99 to 101 would be normal. After I have that temp, again, notate it. And my last one would be heart rate. You can best hear the heart on a horse on the left side, but it is important to auscultate to it on both sides. They are known for, I believe, a second degree AV block. Common thing to look out for in horses. So I would auscultate to get my heart rate, and at the same time I would be feeling a pulse to make sure they don't have any pulse deficits. So a facial pulse is a pretty good one on a horse, right on their face behind the eye, making sure there's no deficits, recording my number. Normal pulse heart rate on a horse would be 28 to 40. So a little bit lower than somebody in small animal medicine might be accustomed to. After those vitals, while I'm already in the chest, on my facial exam, I totally forgot, it's important to inspect the muzzle on a horse. Again, also looking for discharge and inflammation, notating any color of discharge we find, and then an oral exam, looking in the mouth. This may be difficult to do without sedation depending on the horse, but very briefly looking to see how their teeth look, make sure there aren't any missing or cracked teeth that would impede their ability to eat. In a horse, the normal tooth formula would be that there's 3 incisors, 1 canine, usually 3, sometimes 4 premolars, and 3 molars. If I can see all of those in the mouth, great. Otherwise, they may need to be sedated for a full oral exam. And now I would move down to auscultating to all of their 4 GI quadrants. So for the GI quadrants here on the left side, first I would start with my small intestine, which is a little bit higher up here. Listen to make sure there are small intestine sounds, so I know the GI tract is working. And then moving down here, it would be more the large intestine. Make sure I hear sounds there. And then going in front of the horse, I would go to the right side to listen to the next 2 quadrants. Over here we mainly have the cecum, again, higher on the horse, closer to the back, and then again down below, and again mainly the cecum here on the right side of the horse. After that GI check, I would also make sure to auscultate the lungs, again on both sides, listening for crackles, wheezes, any loud sounds, stridor, and notating anything I find that's out of the ordinary. And then again doing it on both sides, walking around the horse in the front, not the back. Notate that. After the lungs, I might move on to working my way down the horse, and checking the limbs. So feeling the limbs for any heat or swelling, any pain response, and then with the help of somebody, it's ideal to check the hooves. On all the legs, I'm looking for different colors and textures. A hoof should be firm but not hard, and it shouldn't be too hot. If I'm feeling a lot of heat or a very strong pulse, that could be a sign of something wrong. Looking at that white line, if I'm seeing holes, sponginess, or foreign bodies, that's important to bring up and have investigated further so that we don't cause lameness because of something wrong in the hoof. But yeah, work my way down all of the limbs, checking all of the hooves, with the help of somebody bringing them back so I can check the hooves, and going around, yep, on all sides to check those limbs and check the hooves. After that exam, I might move on to a urogenital exam. Might do a tail tie to have that tail up and out of the way, and having somebody hold the halter in the front while I do this, and gently work my way to the back of the horse, touching their side to let them know that I'm there. Looking for the color of the urogenital area, seeing if there are any signs of diarrhea left over back here, redness, inflammation. You can also check the mucous membranes back here, see how those look. And the last thing I've forgotten is my skin check. Checking the skin right at the shoulder blades, I can check for the hydration level by doing a tint. If the tint is slow to recede back into the horse, that's a sign of dehydration. Also checking for dryness, checking for external parasites. And I believe that concludes my exam of our horse here. As I mentioned earlier, this horse is a little bit overweight, but their gait imaginarily looked good, and this is a horse I probably wouldn't recommend for any further checkup, but maybe a deeper exam with the history with the owner of what they're feeding them, so that's causing them to be overweight, or maybe their exercise regime isn't quite up to snuff. And that's my exam. Thank you.